As advances in technology and the internet bring us closer to information and each other, a new world of participatory medicine is evolving, in which networked patients are shifting from mere passengers to responsible drivers of their health. Today, these e-patients are empowered, engaged, equipped, and enabled. I'm Susan Hunt, and today we'll show you how technology, from personal health records, patient portals, and home monitoring devices to email and social networking sites, can help you make better decisions about your health and health care.
Well, in January of 2007, I had a shoulder x-ray just for a sore shoulder, stiff shoulder. And totally by coincidence, the x-ray also showed a spot in my lung, which turned out to be kidney cancer that had spread all through my body. The median survival for my condition, according to the best evidence, was just 24 weeks, 5.5 months. I faced saying goodbye to my mother, saying goodbye to my daughter, and not to mention my wife. And then I got to work. I've always been an activated, online, engaged person. Sometimes I say that I learned how to be an e-patient, empowered, engaged, equipped, enabled, back on CompuServe on the desktop publishing forum when we people who were in the same boat talked about the problems we were having with desktop publishing software and compared notes. So that was the most natural thing in the world. My doctor referred me to a patient community. And in the first 2 hours after I posted a message there, I got just a ton of useful information. There are no sure cures. There's this stuff called interleukin that usually doesn't work, but sometimes it does. It has drastic side effects, so you got to get to a specialist hospital and on and on. I had a huge operation, 5.5 hours of laparoscopic surgery, just lots of medical miracles. And just all I did was do everything I could to help them save me. The upshot of it all was that for me, the interleukin did work. Holy cow, I thought that in the video game of life, it was game over. But instead, up popped this free replay thing. In 2007, I started a blog. I called it The New Life of Patient Dave. A couple of months later, my doctor introduced me to this e-patient movement. And I thought, holy cow, this is what I was doing. I didn't know there was a name for it. So I just renamed the blog The New Life of E-Patient Dave. And then in 2009, I wrote a blog post about my electronic medical record that ended up on the front page of the Boston Globe. And I started getting invited to health policy meetings in Washington. People were contacting me saying, well, what does e-patient Dave think about this and that? I don't say that anybody should be like me. I do say that when somebody wants to get actively involved, we should give them all the information and tools and resources and advocates that we can. My appeal is not the medical establishment is corrupt or this is all a bunch of baloney. My appeal is let patients help.
And today I'm joined by Dave DeBroncard, also known as e-patient Dave on the internet, and Lygia Ricciardi, who is Senior Policy Advisor for Consumer eHealth at the U.S. Department of Health and Human Services. Wow, we are really starting to see a culture change when it comes to being a patient.
Yes, we are. The internet has changed an enormous amount, and this is a big deal. It can be hard to adjust. Culture is the shared expectations and beliefs we have about how people are supposed to act and what different people are capable of. And, with patients having access to their medical records and information online and talking to other patients, they're able to do things that were never possible before.
And we're beginning the process. And when you talk about health information, we are talking about two different areas, aren't we? One, your records, and the other is just information that's available on the internet.
Yeah, so there are a couple things going on. I mean, one is, for the first time electronically, many patients can get direct access to their own health record that previously would only live in an old-fashioned manila folder in a file cabinet in your doctor's office, that he or she wasn't able to share with other doctors or with you. And increasingly now you can get that information online, and ideally too you can take it and you can plug it into other kinds of apps and tools, even things on your smartphone, to use it in ways that are creative and that help you meet your own health goals.
And how does it help the doctors when we have access to that? And all of you, basically all of your health team?
Well, no doctor, no nurse can possibly perform to the best of their ability if they don't have all the relevant information. I mean, one of the worst tragedies, I think, in healthcare is when something goes wrong and the doctor or nurse who is involved says, I didn't know. You know, and this is one of the great things that electronic medical records will address.
Also, there are incentives for doctors and for healthcare providers to take this step into the digital age.
Yeah, so we're at a really important turning point, I think, because traditionally the medical field has lagged way behind many other industries in terms of adoption of technology, and that is changing through a set of incentives for doctors and hospitals to adopt technology and to use it in ways that really improve care. That's a program called Meaningful Use, and it's run out of the office that I work for.